Hello, I'm Dr. Pramod Bhor, Director of Orthopedics at Fortis Hospital, Vashi. Today, I'll speak to you overall about the orthopedic department at Fortis Hospital, Vashi, and what we are doing here. So, orthopedics majorly handles bone and joint as well as musculoskeletal injuries as well as musculoskeletal problems. So, here at Fortis Hospital, Vashi, if I consider my department, I can divide it into 4 parts. Number 1 is joint replacement. Number 2 is arthroscopic surgery, that is sports injuries. Number 3 is spine surgeries, and number 4 is trauma. So here we handle all these 4 departments, units rather I would say, in the orthopedic department. So in joint replacement surgery, we do hip replacements, knee replacements, even we have operated an elbow, shoulder replacements, reverse shoulder replacements. These are the very common surgeries that we are doing, as well as partial knee replacements. Advantage of doing it here, we have a program of a joint replacement where it's a comprehensive program where the physiotherapy team, the anesthetist team, and everybody know what they are doing. It's a fixed protocol. We do not change any protocol for any patient. Depending upon the patient, accordingly they are advised accordingly. We have an advantage of using a joint replacement robo here, which is the only fully automatic robo in the whole world, which we use for doing knee replacement or a partial knee replacement, and in the coming future the hip replacement as well. This is about joint replacement. We have approximately done 400 odd robotic knee replacements in the last 1.5 years alone. Coming down to sports injuries, we have a sports injury team which specializes in arthroscopic surgeries, ranging from arthroscopic meniscus, arthroscopic ACL reconstruction, that is for the knee, as well as the shoulder, that is the rotator cuff injuries, Bankers repair, recurrent shoulder dislocations. All these kinds of arthroscopic surgeries are performed at Fortis Hospital. Even the tendon injuries, muscle injuries are taken care of. We have a sports rehabilitation program where injury rehabilitation program rather I would say, where the physiotherapists come into play along with an orthopedic surgeon, and they plan the rehabilitation and going back to the sports accordingly. Third thing that, as I said, in the orthopedic department is the spine department. For spine surgeries, we do minimal invasive surgeries, endoscopic surgeries, as well as minimal invasive spine discectomies, microlumbar discectomies, T-lifts, etc. So these are majorly even up to a certain extent, trauma of the spine is also accordingly handled. Coming down to the 4th unit, last but not the least, most important part of orthopedics is handling trauma. So we have a basic trauma unit that is there starts from our casualty, that is the emergency room. Certain times the TAT for an emergency surgery is from the emergency room to the OT is around 5 to 10 minutes if needed for a vascular injury as well as open fracture. Or we normally handle all kind of trauma, including high velocity traumas as well. The highlight of our trauma team is that we do all the surgeries in a minimal invasive fashion, and up to a certain extent we do complex traumas as well. So for an overview of a department, yes, joint replacement, trauma, spine, as well as arthroscopic surgeries, we are doing everything at Fortis Hospital, Vashi. Thank you.